Hello everyone, welcome back to the Life More channel. Today, we're going to explore the 8 signs of stroke and understand how recognizing them can save lives. If you're not subscribed yet, don't forget to subscribe and turn on the notification bell so you don't miss any videos. Recognizing the signs of stroke early is crucial because stroke, or cerebrovascular accident, is a serious medical condition that requires immediate intervention. Stroke occurs when there's a disruption in blood flow to the brain, either due to a blocked blood vessel, ischemic stroke, or a ruptured blood vessel, hemorrhagic stroke. When this happens, brain cells begin to die within minutes, which can result in permanent damage or even death. Recognizing the signs of stroke early can lead to a rapid response and appropriate treatment, which can minimize brain damage and increase the chances of full or partial recovery. Without further ado, let's dive into the 8 signs of stroke. Imagine waking up suddenly and realizing that half of your face feels numb. You try to smile in the mirror, but only one side responds. This can be frightening, but it's more than just a passing problem. This is the first sign of stroke, facial weakness or numbness, and it needs immediate attention and action. Sudden facial weakness or numbness may indicate that part of your brain isn't receiving adequate blood flow. This often occurs when a blood vessel in the brain is blocked by a clot or ruptured, depriving brain tissue of oxygen and essential nutrients. The result can be devastating, leading to permanent brain damage, disability, or even worse. Therefore, if you or someone you know experiences sudden facial weakness or numbness, don't hesitate to seek immediate medical help. Call emergency services or head to the nearest hospital without delay. Every second is precious and can make the difference between life and the beyond. Second sign, weakness or numbness in the arm. Weakness or numbness in one arm may indicate that part of the brain isn't receiving adequate blood supply. This happens when a blood vessel in the brain is blocked by a clot or ruptured, depriving brain tissue of oxygen and essential nutrients. As a result, the ability to control one arm may be compromised, causing weakness or numbness. This loss of control can have devastating consequences. In addition to impairing the ability to perform simple tasks like holding objects or dressing, weakness or numbness in one arm may indicate significant brain damage. Without immediate treatment, this damage can become permanent, permanently affecting the individual's quality of life. Imagine trying to communicate and realizing that the words aren't coming out as they should. Difficulty in speech can be an alarming sign that something is terribly wrong. This is the third sign, difficulty in speech. It's essential to recognize and deeply understand this sign for a prompt and effective response. Difficulty in speech during a stroke is a direct consequence of interrupted blood flow to a part of the brain responsible for language and communication. This can result in a range of issues, from the inability to form coherent words to confusion in articulating phrases. The sudden loss of the ability to express oneself verbally can be extremely distressing and upsetting. Additionally, it can hinder communication with others and prevent the affected person from seeking immediate help. Failure to address this issue can lead to permanent brain damage and loss of essential language skills. It's crucial to understand that difficulty in speech during a stroke is not just a matter of stumbling over words. It's a medical emergency that requires immediate attention. Prompt identification of this symptom and seeking medical assistance can make the difference between full recovery and serious complications. If you or someone you know experiences sudden difficulty in speech, do not ignore this symptom. Seek medical assistance immediately by calling emergency services or heading to the nearest hospital. Fourth sign, sudden confusion. Sudden confusion during a stroke is a direct consequence of interrupted blood flow to critical areas of the brain responsible for cognition and decision-making. This can result in disorientation, difficulty in processing information, and lack of mental clarity. Sudden confusion can be extremely distressing and frightening. It can hinder understanding of what's happening and impair the ability to seek immediate help. Failure to address this issue can lead to permanent brain damage and compromise reasoning and cognitive function. It's crucial to recognize that sudden confusion during a stroke is not just a moment of perplexity. It's a medical emergency that requires immediate attention. Prompt identification of this symptom and seeking medical assistance can be crucial for treatment outcomes and patient recovery. Fifth sign, difficulty in vision. Imagine suddenly losing vision in one of your eyes, as if a dark curtain abruptly closed. Vision difficulty is more than just a passing blurry vision. It's a serious sign that something is wrong with your brain and needs urgent attention. Vision difficulty during a stroke results from interrupted blood flow to the brain region responsible for visual processing. This can lead to partial or complete loss of vision in one or both eyes, manifesting as blurry vision, double vision, or loss of peripheral vision. The sudden loss of vision can be terrifying and disorienting. Besides compromising the ability to see clearly, it can also hinder navigation and understanding of the surrounding environment. Failure to address this symptom can result in irreversible vision damage and negatively impact the individual's quality of life. It's fundamental to understand that vision difficulty during a stroke is not a simple ophthalmological issue. It's a medical emergency that requires immediate attention. Identifying and promptly acting on this symptom can be crucial for minimizing brain damage and maximizing recovery chances. Sixth sign: sudden and intense headache. The sudden and intense headache during a stroke is caused by interrupted blood flow to the brain, resulting in increased intracranial pressure and irritation of sensitive brain structures. This pain can be described as the worst headache of someone's life, often accompanied by other symptoms such as nausea, vomiting, and sensitivity to light. This is not a common headache that can be ignored or treated with painkillers. It's a medical emergency signal that requires immediate attention. Failure to address this symptom can lead to severe brain damage, intracranial hemorrhage, and even death. It's crucial to understand that the sudden and intense headache during a stroke is not something to be underestimated. It's a clear sign that something is wrong and that immediate medical intervention is necessary. Identifying and acting promptly on this symptom can save lives and reduce the risk of permanent brain damage. Seventh sign: dizziness or loss of balance. Imagine suddenly feeling like the ground is moving beneath your feet, that your head is spinning out of control. This sensation of dizziness is not just ordinary vertigo. It can be a warning sign of something much more serious. Dizziness or loss of balance during a stroke occurs due to interrupted blood flow to the brain, affecting areas responsible for balance and coordination. This can make the person feel like they're floating, that the surroundings are spinning around them, or even that they're about to fall for no apparent reason. This sudden sensation of dizziness and loss of balance should not be ignored. It can be a sign that a part of the brain is not receiving enough oxygen, which can lead to irreversible brain damage if not promptly treated. Additionally, loss of balance significantly increases the risk of falls and serious injuries. It's crucial to understand that dizziness or loss of balance during a stroke is not just a passing symptom. It's a medical emergency signal that requires immediate evaluation and treatment. Ignoring this symptom can result in devastating consequences for the health and well-being of the affected individual. If you or someone you know experiences sudden dizziness or loss of balance, especially if it's accompanied by other stroke symptoms such as facial weakness, difficulty speaking, or confusion, do not hesitate to seek immediate medical help. Eighth sign: fainting or loss of consciousness. Fainting or loss of consciousness during a stroke is a direct result of interrupted blood flow to critical parts of the brain that control consciousness and alertness. This can happen suddenly and without warning, leaving the person unable to respond or interact with the environment around them. Loss of consciousness during a stroke is an extremely serious symptom. It indicates that the brain is not receiving enough oxygen to function properly, which can lead to permanent brain damage and even death if not promptly treated. Additionally, fainting significantly increases the risk of secondary injuries, such as falls and head trauma. It's essential to understand that fainting or loss of consciousness during a stroke is not just a common fainting episode. It's a medical emergency signal that requires immediate attention and professional intervention. Ignoring this symptom can result in serious and irreversible complications. If you or someone you know suddenly faints or loses consciousness without apparent explanation, especially if other stroke symptoms are present, such as weakness, difficulty speaking, or confusion, it's crucial to seek immediate medical help. Head to the nearest hospital for proper evaluation and treatment. In conclusion, recognizing the signs of stroke can save lives. Do not ignore the symptoms, even if they seem insignificant. Every second counts when it comes to a stroke. Awareness and readiness are our best weapons against this serious condition. Share this knowledge with your loved ones, colleagues, and community. Together, we can make a difference in stroke prevention and treatment. Remember, quick action can save lives. Stay alert, stay informed, and be ready to act in the face of any medical condition. Together, we can protect our health and well-being. subscribe, like, and share. Thank you for watching, and we'll see you in the next video. Until then.